family history of fractured hip, smoking, steroids, rheumatoid arthritis, alcohol, and then it puts in your bone density from the neck of your femoral bone. And then it computes your 10-year fracture risk down here. So we do this routinely on anybody whose bone density comes out in this range. Advanced radiology will do this routinely. American Radiology has no idea what this is. Do not go to American Radiology for your bone density. They don't know how to do it. This takes about 15 seconds. All you type is fracs in Google and up comes this equation. But they don't do it at American Radiology. I don't know why. So you can see, you get this kind of number, and the numbers that we use as a cutoff for treatment are 3% risk at the hip, 20% risk for any fracture anywhere deserves treatment. Those are the standards for WHO and NOF. So this is the number that we look at to decide whether or not you need treatment if you're in that low bone mass osteopenia range. You can't do that calculation if you're on therapy. So it's invalid if you're taking Fosamax, alendronate, Boniva, whatever. It only matters if you've been on no therapy. So we talked about this before. Either you can slow down bone breakdown, or you can make new bone. Or you can do both, but not simultaneously, at least not so far. So these are all the approved medications, and I'm not going to try to read this because that would be impossible. So let's talk about the one therapy that builds bone first. Let me ask you a question first. How many of you have been on osteoporosis therapy? 3. Okay. And were you all on oral therapy? Anybody ever been on any injectable therapy? Yes. Back there? Okay.
My mother has. My mother has.
Okay. So we have 2 basic approaches. We have the oral therapies, which are either bisphosphonates or Evista. The oral therapies are Fosamax or alendronate, Boniva, Actonel, or Evista. Those are the oral therapies. And they all are, at this point I can lump, very similar. You take them once a week or once a month, and they reduce the risk of fracture quite nicely. And that's why they've been the standard of therapy for a very long time. But they're not for everybody. There are side effects of the oral therapies. They can cause heartburn. They're hard to take because you have to be on an empty stomach for 30 minutes, and you have to stand up for 30 minutes or sit for 30 minutes, and they can't be taken by everyone. And so there's been a lot of discontinuation. On top of all that, even if you take it faithfully and you are a perfect patient, it doesn't work in as many as 30% of patients. So if you look at clinical trials, randomizing drug A versus drug B, somewhere between 15 and 30% of patients have no response to oral bisphosphonate therapy. And so those patients, like the one I just showed you, you put them on therapy, you repeat their bone density, and it goes in the wrong direction, you have to do something different. So the advantage of injectable therapy is, you know you got it. The problem with oral therapies like Fosamax and Evandronate or Boniva is that only 2 or 3% of the drug is absorbed. The rest of it comes out the other end. That's why you have to be on an empty stomach. If you actually don't absorb the 2 or 3%, you get no benefit. And we don't know how to predict who those people are. You can't measure a Fosamax or a Boniva or an Actonel level in the blood like you could for thyroid hormone or Coumadin or other therapies which has a blood level. There is no blood level for these drugs. So you don't know if it's in there or not. The only way you can know is to repeat the bone density or measure bone turnover markers, which most doctors don't do. So we know we're going to have failures for oral therapy. That's why people have designed injectable therapies. So we're going to start with Forteo because that's probably least familiar to all of you. And then we'll move on to the other ones, which are also injectable therapies. So this is Forteo. Forteo is a single daily injection given by the patient to themselves. It comes in a pen, just like an insulin pen, uses a needle on the end of it, just like an insulin needle. So it's a 32 gauge, almost invisible needle, a painless injection basically, which we can teach nearly anybody. And if you do that, in this clinical trial, you can reduce the risk of fracture by 65% of a vertebral fracture in 1 year. Now think of any other therapy that we do and the beneficial rate. If you're on Lipitor, what's the benefit of Lipitor? Reduce your risk of a heart attack by 35%. This is 65%. No other therapy works this well. You take blood pressure medicine, reduce the risk of stroke by 30, 40%, not 70%. So the therapies for osteoporosis have a greater clear-cut benefit in a reasonable time frame. It's not 10 years, it's 1 year that we can see this benefit. So you can see, this is the dose that we used, 20 micrograms. Risk reduction was 65%. If you look at non-vertebral fractures, so we're talking about hip, wrist, rib, pelvis, it's about 50%. So not just vertebra, but any fracture is reduced by a minimum of 50%. And this was a 2-year trial, so we're looking at this at even 1 and 2 years. So we know this drug clearly works. If you look at the change in bone density, I don't think I put that in there. It clearly increases bone density more than any other therapy. But it is injectable, and it is expensive, and it's daily, and you've got to do it. And the downside of this, if there's any downside, this is only 2 years of therapy. It's only approved for 2 years. You don't expect to live 2 years. So after 2 years, it's, now what am I going to do? I have to do something else instead. We'll talk about all these options later on. The other thing that Forteo does is it reduces back pain. So if you have an acute fracture, this may be the drug that you want, because it's going to reduce the pain as well as make your bones strong. And now we're stuck on this side. Stuck computer. Oh, there we go. Nothing happened. Okay. So this is the change in bone mineral density that I wanted to show you. This is a head-to-head trial of Forteo versus alendronate or Fosamax in patients who take steroids. So you can look at, this is the change in bone mineral density, the lumbar spine. You can see that the increase is essentially double compared to alendronate. This is not a fracture trial. I'm not telling you that Forteo is twice as good as alendronate, because if you look at fractures, the results are fairly similar. But in terms of change in bone mineral density, Forteo clearly wins. And that's not good. I guess this one doesn't want to work anymore. Now, what happens in 2 years? You treated yourself with Forteo for 2 years. What happens at the end? Now we got males on the slide here, so now you're in the picture. You can see here we are, 24 months. After a year or so, it starts to slide back down again. So you must follow up Forteo with some other therapy. It's not a lifelong therapy. So at the end of a year or so, we need to reinstitute something else. The question is, what's that something else? Now, one of the big issues that people worry about with osteoporosis therapies is osteonecrosis of the jaw. You all heard about this one? I see a few nods. So I have a lot of patients who come to me and say, I'm not taking that drug because I heard about the side effects. This is the side effect they've heard about most of all. They're worried about osteonecrosis. You said no, so I have to explain. Osteonecrosis of the jaw is a non-healing ulcer in the mouth that persists over 6 weeks. So it almost never occurs spontaneously. It occurs when you have some kind of dental work done, and then the dental work doesn't heal. Pull out a tooth, doesn't heal over. And so it's what it is very annoying. It's not lethal, it's uncomfortable, it's always going to heal, but they make this enormous big fuss about this thing because it can occur. So Forteo actually increases bone density in your mouth and encourages healing. So you can cross this one off the ONJ list. It is not a problem for this drug. Don't lump it in with the rest of the stuff. So who gets Forteo? This is not for people with osteopenia. It's for people who have more severe osteoporosis. High risk for fracture, meaning you've had a fracture, you have multiple risk factors for fracture, or you have failed or are intolerant of other therapies. So it's typically given If you've been on oral therapy and it didn't work, or you had a fracture